Good morning. I'm Pat Living with the Department of Health and Social Services and your moderator for the COVID-19 update for Wednesday, June 16th. We are joined today by Yukon Premier, the Honourable Sandy Silver, Council of Yukon First Nations Grand Chief Peter Johnston, and Yukon Chief Medical Officer of Health, Dr. Brendan Hanley. Our sign language interpretation is provided by Mary Thiessen and our French translation by André Boursier. Following our speakers, we will go to the phone lines for questions from reporters. We will call you by name, and you will each have 2 questions. Premier Silver.
Thank you very much, Pat. And thanks everybody for joining us today on the traditional territory of the Kwanlin First Nation and the Ta'an Council. I'm very pleased to be joined here today with the Council of Yukon First Nations Grand Chief Peter Johnston and also Dr. Hanley, Andre and Mary as well. We're here to talk about the COVID-19 outbreak and that is happening in our territory. This is no doubt a serious situation. We're very sad to announce that a Yukoner died this week as a result of COVID-19. This is absolutely devastating news to the territory. On behalf of the government and all Yukoners, I send my sincerest condolences to the family and friends of this individual. This death is connected to an outbreak in Whitehorse. Several new cases have been connected to this outbreak, and contact tracing is still underway. The outbreak directly involves the graduating class at Porter Creek Senior Secondary School, 2 classes at Elijah Smith Elementary School, and several social groups that have been partying together. The close contacts of all of these individuals are also connected to the outbreak. So to be clear, we are talking about dozens and dozens of people that may have been exposed. As I said, contact tracing is underway. More cases have been identified overnight, and Dr. Hanley does have details of this. Specific guidance has been provided by Yukon Communicable Disease Control to all student groups and parents. Fully vaccinated contacts of any of the outbreak groups who have not had prolonged household contact should self-monitor for symptoms. Household contacts, including those who have been vaccinated, still must self-isolate. If you have symptoms, arrange to get tested as soon as possible. Anyone experiencing symptoms in Whitehorse should call the COVID-19 Testing and Assessment Center at 867-393-3083. Or you can book online to arrange for testing by following the links on yukon.ca. People in communities should contact their rural healthcare centers as well. As Dr. Hanley will tell you, the primary risk right now is not the importation of COVID-19 from outside the territory. The biggest risk is continued spread of COVID-19 connected to this outbreak. We need to focus on containing this spread. There are some clear factors involved in this outbreak that we need to understand. Of the 36 cases diagnosed since June 4th, only 2 have been fully vaccinated. We do not know yet the status of the newest cases, but that information will be forthcoming. The unvaccinated individuals are at a much greater risk at this stage in the pandemic. COVID-19, especially variants of concern, spreads much more easily amongst those who are not vaccinated. Without the protection of the vaccine, you are also at much greater risk of having more severe symptoms that could result in hospitalization or sadly even death. The vaccines provide the best level of protection that is currently available to fight this disease. In fact, without our early, aggressive vaccine rollout and without youth vaccine rollout that is happening right now, this outbreak would be a lot worse than what we're seeing right now. If you are not vaccinated, you need to make an appointment. We have enough vaccinations for everyone who wants them. If you have any questions about the safety of the vaccine, please reach out to your doctors or community nurses, or talk to folks that you know have already received the vaccine. Getting immunized is the best thing that you can do to protect your family, your friends, your colleagues, your neighbors, Yukoners. And it's our path out of this pandemic. We also know that the outbreak is linked to situations where people are socializing in close proximity to one another. This includes bush parties, house parties, and sometimes even breaking some of the rules and socializing in the bars. This simply has to stop. This outbreak has left no room for doubt. We have, if we let our guard down, this vaccine or this virus will absolutely take advantage and spread. We have taken a very careful and measured approach to lifting restrictions, but we are relying on Yukoners to follow the public health recommendations that are in place. I know that it has been a long time dealing with this pandemic, and we are all wanting to get over it, quite sickly. I know we're all kind of sick of it. But we absolutely must stay vigilant right now. You might be done with COVID, but COVID is not done with you. We all have a role to play in keeping this territory safe. Here's me being a broken record. Please practice the safe six. Wash your hands often, maintain physical distancing, stay at home if you're sick, travel responsibly and respectfully, self-isolate as required, and follow the gathering guidelines. It is also still very important to wear your mask, especially when you cannot maintain physical distancing and when you are around folks who are not in your social bubble. I'm fully vaccinated and I'm still wearing my mask. The actions that you take are not just to protect yourself, they are also to protect your family, your friends, and your neighbors. And keep in mind that masks are still mandatory in outdoor public spaces. I can't overstate how important it is for us all to take these important steps to keep our territory safe. We will see more cases from this outbreak. We have talked many times in these updates about how quickly things can change if we're not careful. We have seen it in other jurisdictions, and now we're seeing it here at home. It is no longer a hypothetical situation. This is a serious situation, and we need to take it seriously. Now is not the time to have big house parties or bush parties. Don't go out drinking with people that you don't know. Be careful, be vigilant, and do your part to keep your community healthy and safe. We are increasing our enforcement efforts to ensure that the rules are being followed. A lot of organizations and folks have been doing a tremendous job, but clearly some are not. When it comes to the Safe 6+1, we need to take this seriously, so we will be stepping up enforcement. If you are aware of a situation that shouldn't be happening, if you have concerns, you can make anonymous calls. Call 867-393-6210. Now more than ever, we need to work together to support each other to get through this outbreak. We need to recommit to practicing the Safe 6+1. We need to keep the health and safety of our fellow Yukoners in mind with all of our actions, and this includes stepping up and taking your shot if you haven't already, following the direction of our amazing public health officials. They have been working around the clock to keep us safe, and they've been doing it for 16 months now. We will get through this, folks, but we all need to do our parts. And I know many Yukoners have been doing their part, and I know that I'm probably preaching to the choir. The folks that pay attention to these press conferences on a weekly basis, for the most part, these are the folks that are doing all the things, and I thank you for keeping up on these updates by following the direction. I know when I was in grade 12, I probably wouldn't have been paying attention to these meeting conferences. I'd be probably doing other things on a Wednesday. But I know the parents are listening, and I know the community's listening. It's up to us to communicate to those who are not paying attention. You've all made tremendous difference so far, and we need to keep it going. I'm asking you to get this message out to those that are not listening. Thank you very much.
Thank you, Premier Silver. Grand Chief Johnston.
Yes, Gon Chief Lakatjuan, Yakheitsu Tot Achoni. Just want to thank the Premier for this opportunity today to join him on the press conferences. First and foremost, my condolences go out to the family that have lost a loved one due to the COVID-19 pandemic. My heart goes out to the communities also that have been that have confirmed cases within your families, and the First Nation governments are working diligently with the Yukon government along with the Chief Medical Officer to ensure measures are in place for community safety. The fact that we know that there was confirmed cases at the Native Grad, and I was there celebrating their achievements as well. I feel very safe. The fact that I have both of my shots now, and I feel very safe for my family as well. I was, under the opportunity had to be taken, and it was a pleasure for me to be there. We want to make sure that the communities are safe and that our elders are safe and that family can still celebrate with the grads and take in this achievement, as it is a very special time in our life. So please do your part. If you're in contact or are not fully vaccinated, please follow the orders and self-isolate and get tested if you have any symptoms. If you have been exposed or are fully vaccinated, please self-monitor. If you're physically able, and I encourage the ages of 12 to 17 to get vaccinated this week to keep our communities safe. The Pfizer is available this week for the first shot. And also, ALs are able to book their vaccinations online through the community health nurse. So with that, I just want to encourage people to get their shot. I think it's a very important time in our history. And as the Premier's mentioned, we can get through this, and I think it's in our part to do our part, and it is our responsibility to get our shots. So I encourage you to do that, and just want to thank everyone for their time today. Lunshish.
Thank you very much, Grand Chief Johnson. Dr. Hanley?
Lunshish, Grand Chief. Thank you, Premier. And it's an honor to be here with both the Premier and the Grand Chief today. Good morning, everyone. Bonjour. As you know, Yukon's current situation continues to change by the hour as more cases associated with the exposure events are identified. As we received results on 16 new cases and another probable case overnight, we now have, as of this morning, 50 active cases, including 2 outside the territory and in addition, and including 1 probable case. This brings our total count to 136 plus 1 probable case, with 51 confirmed cases since this outbreak began. Out of those 51 cases, 3 have been hospitalized, and sadly, 1 individual has died, bringing our total number of deaths associated with COVID infection to 3. And I also want to add my sincerest sympathies to the family of the individual who recently passed away. And this is another sad loss and a troubling week for Yukon. My colleague, Deputy Chief Medical Officer of Health, Dr. Catherine Elliott, officially declared an outbreak on Sunday afternoon. And I'm grateful for all the work that Dr. Elliott and all our amazing public health folks have put in to define and to manage this outbreak. YCDC, the Communicable Disease Team, the testing teams at CTAC, community nursing in the rural health centers, and the crew team here as well. And also thank you to the many people and families who have cooperated with us, who have shown up to get tested, and who are doing the right thing when self-isolating. It takes a whole village to manage an outbreak. And with the rapid number of cases growing across multiple age groups, it is imperative we remain alert and take a measured and cautious approach over these next few weeks. A couple of weeks ago, we had no active cases in Yukon, while we watched our neighbors to the south and the east struggle with increasing case counts and illness. You could say in a way that it's now our turn. Just at the point we thought there was an end in sight and we were ready for further relaxations, this hit us. Many thought that up here we were finished with COVID. But as the Premier said, we have certainly found out that COVID is not finished with us. On the other hand, despite the 3 individuals who have been affected with serious illness, we know that this outbreak, although affecting many, will eventually peak and end. We know that 3/4 of our adult population and 90% of our elders are protected with vaccine, and that is very reassuring. We are not going to see our hospitals fill up with COVID patients, as the vast majority of young people, even with variant COVID-19 disease, will do okay. But we do have a tough spot to get through first. We need all hands on deck to protect our communities, our young people, and those who have not yet been vaccinated. We are suffering through this outbreak together, but we will get through this together. This outbreak and the few individuals with serious infection remind us in the strongest way that we still need to be careful, to be mindful of our actions. Now more than ever, it is important to stick to those safe 6 measures and to wear a mask in the appropriate circumstances, including in indoor public spaces. Now, I will provide some further detail on what we know currently. And because we had fresh cases identified last evening and through the night, getting exact numbers will always be a shifting problem until we get confirmation and get more of a story from the cases. But as of first thing this morning, this is our situation. Our total number of active cases is 50, of whom 49 are confirmed, and of those 49 2 are out of territory residents, and one is probable, who is also a Yukon resident. So our active cases are 50. We have a total, as I mentioned earlier, of 3 that were hospitalized, including 2 who were medevac out of territory. We now have 4 recovered. And of course, we had the one sad loss of a person that died. Vaccination status, again, this is incomplete because we have yet to confirm all of those 16 cases through the night as to their vaccination status. But the ones that we know of, we had fully vaccinated 2 cases, both of whom had very mild symptoms. Partially vaccinated 3, unvaccinated 33. So we have another 16 or 17 where we still need to confirm that status. And as of this morning, 44 cases in Whitehorse and 6 in rural Yukon in a number of different communities. Now, again, both of the fully vaccinated cases that we've had in this outbreak have had very mild infection. Again, reminding us that this outbreak is demonstrating the stark difference in outcomes between those who are protected with vaccine and those who are not. And as previously mentioned, this outbreak is one of the Gamma or the P1 variant, which is clearly more transmissible than the previous COVID that we knew. And of course, this outbreak has been linked to a number of exposure events, and I will discuss these in a bit more detail. We are seeing strong links with the grad-related events and parties that took place this past weekend. And we're also seeing activity amongst young adults who have been frequenting various bars and restaurants around Whitehorse. And again, this is more the gathering behavior. It's not the bars and restaurants themselves, but the gathering behavior around or inside certain bars and restaurants. So these the case individuals are linked to a series of events and locations, and if we put that all together, there has been contact between cases and hundreds of other individuals. So I expect that in the coming days, we will continue to see additional cases that will likely number in the dozens and may reach hundreds. Because the exposure events involve many people and because there has been secondary spread within households or among close social contacts, we're now seeing widespread infection, primarily amongst younger, unvaccinated adults and youth. We have many cases where we have no known connections to a source yet, although we suspect that the cases are somehow linked back to these initial gatherings. Now, youth have not had vaccine available to them for long, those 17 and under. So as a group, they are still highly susceptible to COVID infection. Now, younger adults have been coming forward much more in recent weeks for the first dose of vaccine, but still 30% are unvaccinated. And this has always been the group we have been more worried about because of their coming relatively late to vaccine uptake, and of course because of that natural tendency, as we all experienced, to socialize closely and to gather. So what to do now? First, we want to continue to test as many people as possible. Anyone with symptoms, even without a known exposure, should get tested, as we are still identifying some cases not directly connected to others. Now, if you're a household contact of a case and required to self-isolate, then follow the instructions of YCDC nurses and take that advice to heart. The best advice for self-isolation, who needs to self-isolate and how, comes from YCDC. That's, I would say, the source of truth for public health. If you have been told to self-monitor because you're a lower risk contact, take that responsibility seriously. Make sure you self-isolate promptly and get tested if symptoms develop. If you believe that you have been in contact with a case and you haven't yet been contacted by YCDC, the best course of action would be to self-isolate and call YCDC for advice. Now, here are some more very specific instructions for those who frequented certain gatherings linked to the outbreak. Anyone who participated in the SEMA post-grad event on June 10th to 11th, that was overnight, is considered a contact of someone with COVID-19 and should isolate until June 25th. There were people who participated in First Nations After Grad event, and those people, if they haven't already been contacted, should consider themselves contacts as well. There are the Porter Creek grade 12 students and staff, and they're considered a contact of someone with COVID-19. Anyone else involved from June 4th to 10th in group activities. And there are a few examples, such as the camping group in Tagish from the 4th to 6th of June. There was a Sunday, June the 6th, a prank event, a foil and balloon event at Porter Creek, and a cap and gown rehearsal on June 10th. Then you should consider yourselves contacts of someone with COVID-19. So all of these contacts should isolate until June 25th. Now, a note that if you're fully vaccinated, you do not need to self-isolate, but should self-monitor and get tested if any symptoms occur. Just because of all this advice, there are now hundreds of people in self-isolation. And that is what you might call a focused lockdown measure. And that is how we will control this outbreak. Now, clearly that means a lot of people have been tested, and a lot of people will continue to be tested, and that's great. And I also want to take this opportunity to thank the laboratory staff at our hospital that have been running a gene expert rapid testing, as well as our laboratory colleagues in BC, where we continue to experience tremendous turnaround times considering the travel involved. And most of our results coming in within 2 days or less. So what does close contact mean? It could mean any of the following. It could mean chatting with someone for a few or more minutes at a party without proper physical distancing. Perhaps you shared a drink or a vape. Perhaps you kissed them or had someone cough or sneeze on you or sang a song together. Remember that this gamma variant is much more easily transmissible than the previous COVID strains we knew. But vaccine protects well against this variant, and we're now seeing that more and more with some of the Canadian studies, including from BC. But amongst those who are unvaccinated, this variant travels fast. Now, these numbers can seem pretty frightening when they mount quickly. As I said, we will see cases come in day after day for a while. This is our first widespread outbreak, and it has outstripped anything we have seen before. If we see many cases, there is more chance for serious disease to occur, even with young adults and youth. So yes, we are concerned. But panic is not necessary, and fear will not help. We know how to respond to outbreaks. Our contact tracers know their jobs. Our health providers and our testers know what to do. We all have a role, whether as providers or leaders or as public. And each of these roles is crucial to play well right now. We know what to do, and we need to do it. The Premier referred to the Safe 6+1, of course, the same mantra we have used now for over a year, and now we really mean it. Although immunization is an extremely effective tool, it does take some time to fully protect us, which is why we all must stay vigilant to prevent further transmission in Whitehorse and the affected rural communities. So if you're not yet fully vaccinated, it is essential, even more so, that you practice the Safe 6+1. And as the Premier reflected, I know and understand many of you are tired and may not see the continued risk if you're vaccinated, but these practices are crucial to our own and our fellow Yukoners' health and well-being. So as a reminder, keep a distance of at least 2 meters or 6 feet with everyone who is outside of your social bubble. Wash your hands often. If you're sick, please stay home and seek testing. Even though you may feel that you can power through, don't do it. Keep your social bubble small. Now is not the time to introduce new people into your bubble. So if you're planning to have a party for solstice this weekend, do not invite those you don't know. Continue to travel with respect. Consider the risk before traveling between communities. And if you decide to go, make sure to check travel advisories and follow the guidelines when you arrive. Some communities may not feel ready to welcome visitors at this time, but be respectful when making any travel plan. Self-isolate when necessary. Of course, if you're planning to travel outside of the territory and are not vaccinated, you must self-isolate for 14 days. And use masks if you're unable to maintain physical distancing. Even during outdoor events, such as the farmers market, where there may be crowding, where it may be more difficult to maintain your distance, consider wearing a mask. It's okay to do so. Our progress over these next few weeks will be a shared effort. We must all work together to leave COVID-19 behind us, and this may require extra effort on all of our parts. We may have been put slightly off course, but with your help and your efforts, we will be able to continue on our path to progress. Now I wanted to talk about the previous announcement. Sorry, the previous announcement we had made about the children under 12 and being able to travel with unvaccinated, if they are unvaccinated, being able to travel with vaccinated parents or caregivers who are fully vaccinated, and then not having to self-isolate when they return. And some people may be surprised that I would be comfortable with this approach when we're in the midst of an outbreak. But keep in mind that this was a move that we had analyzed previously in terms of what risk of importation of cases this would carry, and we found this risk to be very low, as I explained in previous media updates. And in Canada's climate of rapidly decreasing cases, this risk is probably even lower. For the time being, we wish to maintain that low risk of importation of COVID cases, and this measure does not practically move that risk any higher. At the same time, many families are depending on this provision and have made or are planning trips accordingly. And I think this leads to a really important point. Our risk of COVID spread depends not so much on these occasional introductions, because we have always had them and we will continue to have them, but it's the conditions that favor spread of COVID within a territory. It's not one case introduction into Yukon that has gotten us into trouble. It's the spread within close, crowded, and often closed gatherings of people, particularly now unvaccinated people, that gets us into trouble. I've made the wildfire analogy a few times before, and as hotter weather approaches, I think that is a good one. Think of COVID cases introduced into the territory as little sparks. Think of unvaccinated people as fuel. When you have lots of fuel in one place, a single spark can cause a wildfire. Vaccination protects sparks from causing much more than a flicker. This COVID virus is the spark looking for fuel, and it finds that fuel best in gatherings of people who are not protected with vaccine. But it is a reminder that if you're planning to travel with children who are unvaccinated, it's crucial that you consider a few variables before booking the next flight out of Yukon. While you're traveling, ensure you're well equipped with the pandemic essentials, the non-medical masks and hand sanitizer. Wash your hands frequently, especially when you come into contact with high-touch surfaces. And most importantly, if you're visiting your family or friends, make sure everyone feels well and has not been exposed to COVID-19 before visiting them. And we will have additional information and recommendations on traveling with children under 12 up on the yukon.ca website later this week. The success of this initiative, as always, depends on doing the right thing with your children. So before I end, I know many of you are itching for things to reopen and life to begin transitioning back to normal. And to all of us, this recent news is disappointing. COVID-19, as we know, has turned out to be a tricky and aggressive virus that takes advantage of every opportunity. Unfortunately, we in the North are not immune. And right now we're feeling the brunt of its aggression. In time, we will continue to move forward safely. But for the next few weeks, I ask all Yukoners, please do your part. Follow the Safe 6+1. And if you're not vaccinated, I urge you to book an appointment, as this is our shot. And I am very pleased from what I've heard, although I don't have the numbers yet, of much significantly increased demand at our vaccine centers, whether in rural or here in Whitehorse, and that's very gratifying, and that is the right way through to get us out of this pandemic. So that's it for today. Please take care of each other. Remember, if you feel sick, stay home, self-isolate, and get tested. Be kind, everyone, and stay well. Thank you. Shonethan, Konoshis Mashicho. Et merci.
Thank you all. We'll move now to the phone lines, and we'll begin with Luke, CKRW.
Hi, Dr. Hanley. You mentioned the hundreds of people that are now isolating and this being a focused lockdown measure. I was just wondering if you could explain the comparison of that to tightening up restrictions again, and why that's the approach that's being taken at the moment.
Yeah, thank you. That's a really good question, and one that we have spent a lot of time thinking about. And I think that I know I've said it many times at this microphone, but whether we're in an outbreak or preparing for an outbreak, we always try to figure out where is the risk, and then what's the response what's the right move that responds to that risk. And we are in a very different situation from, again, what this could have been like, let's say before January. And if we had these sorts of gatherings associated with a P1 variant and an unvaccinated Yukon, we would already be in several hundred cases. And we would be seeing severe consequences with that many people affected in the older age groups. So now we're in a very different situation where we are in a situation where we have 72 at last count, I think, percent of our adults, adult population, the over 17-year-olds, fully vaccinated. So we know that the impact of this is very different. And our focus now is on doing everything we can to protect the vulnerable, who are now essentially the people who are unvaccinated. And therefore, the whole focus is on locking down this outbreak and getting anyone who is a contact to self-isolate, and that will help to contain our outbreak. But that doesn't mean we have to shut down society. It doesn't mean that we shut down businesses, because that's not where we're seeing risk. And so the response has to be very different than the typical response that we might have had to do, or that other places with much lower rates of vaccine are doing. And so this is, I guess I like to say, this is part of our rocky road transition to an endemic state of living with COVID. Where we are seeing a very different impact, but now a significant impact amongst our younger population, now dispersed. You see how it is so widespread. There's almost this horizontal spread, but without overwhelming any one place, because it is. People are carrying back infection to where they live, having acquired it in other places, probably mostly in Whitehorse, although, as I say, we haven't put all these pieces together. But this does ultimately look like, because we're seeing consistently P1, one source that has spread into this unvaccinated these unvaccinated populations. So we want to inform these populations. We want them to isolate when they're exposed. We want to encourage vaccination, and that ultimately is going to be our protection. But locking down the rest of the community really doesn't make sense, because that doesn't speak to the risk. So I'm sorry, that's a very long answer to a short question.
Luke, do you have a second question?
I do. Thank you. With all that being said, what is sort of the next step to combat this last little stretch of vaccine hesitancy, where we're seeing, maybe 20-25% that are still unsure, still not necessarily believing that they should get the vaccine?
Yeah, thank you. Another really good question. So one is, as I said, we are seeing a pickup, and for some it's all that. I think that realization that this is real, this has an impact. It can still kill people. It can still get people seriously ill. I know people are changing their minds, and I know there were people lining up for vaccine, and that's great. It's kind of a negative way to stimulate people, but that's the reality. I think for some, they needed to see that this is real, and this can affect our community just as much as any community. So that's part of it, is that there's already some answer there to those who were perhaps holding back. The other part is that there are some refusers who I think will never come for vaccine, and I think, but I think that's a pretty small percentage. That's probably like a 5 to 10%. And I think with the rest, I think we just continue to plug away, and for many people and communities, it's continuing the conversation and setting goals for longer. We're not going to do it all in 2 weeks. We're not going to get everyone vaccinated in a hurry, where people have various reasons, and sometimes it's trust, sometimes it's being able to build up that trust. So I think we don't give up, and we set our sights for the short range and for the longer range at the same time, and we continue to provide what we can in terms of support and information, and work with. Part of it is also helping and working with communities through what to do when there's an outbreak, as we're experiencing now. What are the protections? What are the right measures for where we are? So it's continuing those conversations and building that trust, and we'll get there.
Thank you. We'll move now to Camille, Canadian Press.
Hi there. This is for the Premier. You mentioned that enforcement would be stepped up. Can you say what that will be and when that'll start?
Thanks for the question. We talked with our ECC, our emergency folks, coordinators. I know that the minister has been talking, our CMP as well. I've been talking with chiefs as well. We have guidelines in place. I mentioned in my notes as well, we really need people. If you see people breaking the rules, there's a phone line for people to call, then we can look into those things. We need to increase our vigilance. I know that some communities are fearful of the gatherings that are going to happen at solstice. I'm going to be reaching out, and I know my minister already has, to RCMP to talk about coordinating for some of these gatherings that we know are going to happen. In my community in Dawson, every year people go up on the Dome Road for solstice and party. That can't happen this year, and we have to make sure that if we know where people are gathering and not respecting the guidelines, we need to make sure that there's a presence in these areas. But we're really counting on Yukoners to call the line. If you see somebody who's doing things that they shouldn't do, we get some anecdotal information all the time, and I keep on urging folks to use that hotline. But again, we have enforcement officers in all of our communities, and now it's time for us to revisit our strategies there and to make sure that we're focusing in on the people who are not following these guidelines. Again, it's one of those things where most Yukoners are doing exceptional job of keeping us safe. You know, I've been here at this table many times talking about the restaurants in town and how amazing they have been to make sure that folks that are in their restaurants are doing it safely. You know, we were able to increase the capacity size of folks in those restaurants because of the diligence of the staff and the owners. But again, this is a stark reminder, and this is the reminder that I spoke about just yesterday at the Western Premiers Conference. You know, one of the most vaccinated jurisdictions in North America is having an outbreak. And how do we focus in on what Dr. Hanley has been talking about for months now, us as a society going from pandemic to endemic, and how do we start really getting that message out to people? If you think it's just this bush party this year, and if you're unvaccinated, it's not. It's next year as well. It's the next decade. You know, COVID is not going away anytime soon. And if you're unvaccinated and you have no reason to not be vaccinated, you really have to start thinking about your behaviors, not just this summer, but into the next decade. And so our obligation is to make sure that the rules that we put in place are enforced, and we're redoubling our efforts to do so.
Thank you. Do you have another question, Camille?
Yeah, I didn't get an answer really about what stepping up enforcement means. I mean, are fines going up? Are more enforcement officers being hired? Are they going to different places? Can you give me some detail on that?
So I'll leave that up to the amazing team at ECC to make the recommendations as to what extra resources they need. We made the message that will be available. We need to make sure that we have the people in place in the communities. In the past, what we had as well is people that were on the land. They had different jobs. We're doing enforcement. So we'll be taking the recommendations from the departments as to what they need for extra resources. But the message is clear. We will be more present and again, working with RCMP as well to see what we can do there. We know that the First Nations in different communities have some check stops, getting anecdotal information there as well. So there's been a lot of extra effort. I don't have a dollar value for you if that's what you're looking for, but we are making sure that the enforcement is the control piece. Dr. Hanley can give us recommendations based upon medical science. Our job is to make sure that we enforce the orders that we have in place, and so we will make sure that we are, again, reviewing how we do that currently, but also putting the extra resources necessarily in there in each community to make sure that folks are getting the fines if they deserve those fines.
Thank you. We'll move now to Stephanie, Yukon News.
Hi. You mentioned the children under 12 traveling with parents, but I'm wondering about other restrictions that have sort of been loosened in the last few weeks, whether there was any thought given to tightening those up again, capacity at restaurants, bars, that kind of thing, given the outbreak.
I can start, but I'm sure Dr. Hanley has something to say about this as well. We're very confident with the measures that are in place, that they're appropriate with the issue that we're dealing with currently. And our contract tasting team, they've been absolutely slammed over the last 2 weeks because of the large social gatherings, when people are not practicing the safe 6+1. And again, please, Yukoners, follow those rules. But the current measures that are in place, we believe we're following the guidelines from the medical community. We also need to continue to encourage Yukoners to get fully vaccinated, is the message today. Minister McPhee she congratulated the Yukon Aboriginal Women's Council for their Protecting Yukon's Health project. It's these efforts of making sure that we have the diligence in the communities with the current recommendations that are really keeping folks safe. That project was designed to build trust and relationships with Indigenous women and gender diverse people by providing cultural reassurance about taking the vaccine. This is a fantastic initiative. It's very important. The vaccine, again, is the best tool that we have to get us out of this pandemic. So, coupled with the amazing work that Dr. Hanley and his team is doing to make recommendations that keep us safe, it's these activities of leadership, and Dr. Hanley mentioned leadership is really important at this time. That is making sure that everybody is adhering to the guidelines. But at this point, we're very confident that the measures that have been put in place are appropriate as we're dealing with at this point.
Dr. Hanley?
Yeah, I just to echo what the Premier said, but yes, we did think about this a lot. But again, I think it's where are we seeing the risk and where are we seeing spread, and it really is in these kind of uncontrolled social gathering situations that of many of which we named, so that where we have controls and compliance, we do well. And again, I think we have to consider the impacts of imposing restrictions when we are in a highly vaccinated population. So every approach is going to be different when we have high vaccine rates, and it's really going after the risk, going after where are we seeing remaining risk, and what's the appropriate mitigation for that. And I feel confident that we've made the right recommendations for the right time, and that those recommendations, if followed, are still appropriate for where we are. And let's get on top of this outbreak so that we can get over this, get more people vaccinated, and be in a position to continue with our move towards relaxing restrictions.
Thank you. Do you have a second question, Stephanie?
I don't, thank you.
Thank you. We'll move to Tim, Whitehorse Star.
Yes, good morning. My first question is either for the Premier or Dr. Hanley. Can you tell us whether these organized grad events adhere to the proper regulations, et cetera, or was that turning out to be a problem?
Yeah, again, organized events are not the problem. We have we have a small community, and we have the ability through the Chief Medical Officer of Health to get the guidelines in place for organized events. Again, we're very confident that the measures that are being put in place for these organized events, they're appropriate. And the issue that we're dealing with now is when people don't follow the measures in place. And that's the problem. It's the unorganized events. So right now, again, it's not about people that are adhering to the guidelines, it's those that are not. Now, if we find ourselves in a situation, in the coming days and weeks where we still see people breaking those rules, well, we'll have to readjust our strategy. We're urging people right now that the best way for us to get over this is to make sure that we follow these rules. And if you know folks that are not following these rules, it's up to us as a community it's not about shame, it's not about blame, it's about education. It's about making people know what the rules are and why they're in there. And it's not just about you getting sick, it's about our community being healthy. And, people's mental health is strained right now. And we have young folks that are unvaccinated that we are very worried about because, when COVID hits you and you're unvaccinated, it's a powerful hit. And when you are vaccinated, it's not as powerful. So again, we're confident with the measures now. But we really need to focus in on adherence to those guidelines and principles.
Thank you. Tim, do you have a second question?
Yes, I do. I was wondering if I could get a comment on the decision by the NWT to cancel the travel exemption between the two territories.
Again, every jurisdiction in Canada is following advice from medical officers, and they're making their decisions in each region. Each region is very different and makes their decisions based upon health and safety guidelines. And I'm not going to comment on behalf of Premier Cochrane. We were talking just yesterday with both Premier Sigaviktak and Premier Cochrane at the Western Premiers Conference, and the day before with the Northern Premiers Conference. We keep in close conversations with each other, which is paramount when making decisions. And we wish all three territories well as we get into recovery mode, hopefully as soon as possible. And again, respecting every jurisdiction has big, tough decisions to make.
Thank you. We'll move now to Philippe, CBC.
Thank you. Dr. Hanley, what are your current recommendations when it comes to travel between communities? Is this a suspension of the Great Yukon Summer campaign?
Hi, Philippe. That's a good question, and I'd welcome additional comments from the Premier or the Grand Chief in this regard. My perspective is that we are not suspending anything, but reminding that travel is a two-way communication, and that we just need to be mindful in this situation that we have several communities that have cases. Some First Nations have taken some additional steps, and I think it's just we've always talked about respectful and mindful travel, and I think that is the sort of the key words. It's really if you've planned your trip for the Great Yukon Summer, which I encourage people to continue to do, and I'm looking forward to that myself. It's check in with where the community is right now, and many of them have information on their websites, and I think it's really just that being mindful and being respectful of where we are just at this very point right now, which is it's a pretty tense time, and there's a lot of natural concern about where this outbreak is going. So I think really just some of that consideration needs to be added into the decisions.
Premier Silver?
Yeah, I would just echo that. We had a meeting the other day amongst ministers, and one of the ministers did ask Dr. Elliott, I'm planning a trip to a community, should I still go? And the response was, if you're traveling safely, there's a reason why these requirements, where we are with recommendations and with guidelines right now, they're in place to make sure that people can safely do that. There is an abundance of caution, and it's great to know that one of the Safe Six is travel respectfully and responsibly into these communities. So I think that's the mindset once again as we get into an endemic. We're going to be living with COVID, and as long as you're doing things respectfully and adhering to the recommendations and the guidelines, then you should be able to enjoy a great Yukon summer. And again, as we monitor the situation with the outbreak, this too shall pass. and we will make sure that the recommendations and guidelines are following the medical community on a daily basis. And if there's any update in any of the rules or regulations or guidelines, we'll very quickly get those out to the public. But right now, the rules that are in place are there to exactly do that, to allow us to be able to travel and to do it safely and respectfully, and to get out there and to enjoy this amazing summer and the amazing territory that we do live in.
Grand Chief?
And just to remind everyone that there is cases in the community, so it's up to the respectful governments, First Nation governments, to make that call. But we also have to be mindful that there is also communities in the territory that has low vaccination counts. So we are encouraging everyone to obviously get the shot, but at the end of the day, we do have to be respectful to those communities that have the jurisdiction to make that call. And I just want to once again, advise on that respectful platform. Chief.
Thank you. Philippe, do you have a second question?
Yes, thank you. I wonder if Dr. Hanley could tell us about staffing and capacity in our hospital system. Are the staff able to handle this new volume of cases? And is material taxed by this? How are we doing in handling this wave? Please, thank you.
Yes, thank you. It's a really important question. And of course, among our indicators for resurgence, or if we needed to go into a more restricted state, what are our indicators? And one of our indicators is what is our hospital capacity amongst the Whitehorse and the two rural hospitals, but our overall acute care capacity around our community health centers as well, but also of course our public health capacity. It's I think the Premier said the public health folks have been slammed, and they have, it is amazing, I can tell you, to see the turnaround in case information that we are getting, so that we can stay on top of this. And it's just, line after line as those cases are identified and their links. But yeah, that's a strain, but they have internal surge. They have added staff, and we're collectively staying on top of this. But it is so important to help the contact tracing ability by doing everything I did try to emphasize in terms of those exposures, and if you're connected with those exposures, to do the right thing and self-isolate if you've been associated with this. So we have that individualized contact tracing going on, but we also have this kind of mass contact tracing that is associated with settings and events, and that is a crucial part of it as well. To more specifically address your question, the impact on the acute care facilities themselves has been relatively low. There has been an impact, I would say, and again, to recognize the laboratory testing, because many people have been tested through the emergency department, the outpatient department. I think because of the protocols that they have rehearsed over the last year and a half, they have been able to handle this very well, and again, credit to the cooperation that we have with our colleagues in the acute care system, both in the Dawson and Watson Lake hospitals and here in Whitehorse. And sometimes when, there's always ebbs and flows with everything else, all of the other care that is being provided. And it is so important that care continues so that we meet people's ongoing needs, whether that's emergency episodes, acute care needs, or chronic care, hospitalization, surgeries. All of that needs to go ahead. So I think we're doing okay in that regard as well. But this is a strain, and we can do it over a shorter time. And when we get over the outbreak, there'll be time for recuperation. And again, as we get that higher vaccine rates, if we can get as many people continuing to get vaccine, it means that the impact of any one outbreak is that much lower and that much less strain on the system.
Thank you. We'll move to Julian, CBC. Oh, sorry. I'm sorry. Premier Silver?
Yeah, I just wanted to add quickly as well, on a federal basis, I reached out to Federal Minister LeBlanc this morning. We did say exactly what the doctor said is, it is, folks are slammed, but the system is coping very well. I mean, if it was just COVID that the hospitals were dealing with, that'd be one thing, but, life goes on. There's other things that are happening in the hospitals. But there is a commitment from the federal government if we get into a situation where we need that extra supports. He outlined this type of support that happened in Manitoba with the Hercules that were refigured to be ICUs and taking folks out to other places. That federal support would be there if we did get to a situation where we needed it. But it's good to know that right now the capacity in Yukon is there, even though our medical community has been doing an extraordinary job and been working around the clock.
Thank you. Now we'll move to Julian from CBC.
Hi. This question is for the Premier, sort of following along the lines of stepping up enforcement. I didn't really hear an answer, but you also mentioned as well that there are some in bars who are breaking the rules. Can you just spell out what you mean by that? How are they breaking the rules exactly? Are they not distancing appropriately? What's happening there?
So we get a lot of anecdotal information as MLAs for our ridings, and not just myself, but everybody about certain things that we hear. Now, I keep on saying to people, I can't do anything with anecdotal information. If you have something specific, then we need to know what that is, so encouraging people to use those hotlines. We also know that when we come into situations of surge, when we come into situations for the last 16 months where we are in a situation where there's more COVID, where there's more concern, what we've seen through ECC is an upping of those measures. So nothing is changing other than we're in an outbreak. So in these outbreaks, when we're hearing information, we're just making sure that we're doubling up our efforts to enforce. When we have 0 cases, there's not as much enforcement. When we have as many cases as we have now, enforcement increases and the resources will be available for those.
Thank you. Do you have another question, Julian?
Yeah, I know the tip line was mentioned, but what does doubling up efforts on enforcement mean here? Like, we've never seen as many cases before. Can you please explain what you mean by doubling up on efforts?
I don't know how else to explain it, Julian, other than, when we have more cases, then we need to do more enforcement. And that's what we've seen in the past. And now you're right, this is the most cases that we have seen. But the message to ECC and the message to our departments is that we need to make sure that the enforcement is there. And that's what we're going to do. I don't know what you're looking for as far as if there's a dollar value that you're looking for or, who specifically, but those details are being worked out. And we just know that every time that we have an increase in cases, attach that. One of the things that a government can do is make sure that that enforcement piece is included as well. We've had failure to self-isolate at 1,269 different complaints. We have gathering sizes data. This statistical information, failure to wear a mask, failure to self-distance, this is all very statistically relevant information. And at some times in the past year, we've had not as much of a need for our enforcement officers, and we've seen those enforcement officers who have other jobs go back to those jobs. So right now what we're seeing is, again, is an understanding of how we're going to make sure that these folks that have the ability through CIMA to enforce these rules are back in those positions. And so that work is happening already in earnest. And so that's what we're doing. We know that last week there was 5 new charges under CIMA. There was a failure to isolate, failure to providing false information. There was also 2 different failure to declare enforcement charges. And what we will see in the redoubling of efforts is as cases increase, and in this case, the reason why cases are increased is because of not following the rules, what we're going to see statistically is an increase in the enforcement as well. And like I said, in answering this question today, we will make sure that the resources are there to make sure that the enforcement is done.
Thank you. On va maintenant passer à Laura Boréal.
Oui, ma question est pour le Dr Hanley. Est-ce qu'il y a des moments qu'une personne doublement vaccinée doit s'isoler? Que ce soit les parents, les frères et sœurs des jeunes qui ont participé à des activités?
So, Dr. Hanley, are there specific moments at which people who have been vaccinated twice need to self-isolate or need to do special precautions if their kids or anybody else has been exposed?
Merci pour cette question. C'est peut-être tout simplement, c'est sous la direction du contrôle, le centre de contrôle des maladies communicables de YCDC. Donc, il y a certains cas où le risque est plus haut, surtout dans les foyers, dans les maisons où on peut anticiper un risque de transmission de COVID plus haut que normal. Donc, on a des cas où on demande les personnes de suivre l'auto-isolation, même s'ils sont double vaccinés. Mais pour la plupart, ils sont plus besoin de auto-isoler, mais c'est très important quand même de suivre suivre le self-monitoring, le régime pour self-monitoring. Donc, oui, mais c'est toujours selon les instructions de YCDC.
Avez-vous une autre question, Laurie?
Oui, je redemanderais clarifier, c'est quoi justement les exceptions qui font en sorte qu'un parent qui aurait les deux vaccins devrait quand même s'isoler?
So can you give specific examples of when parents should self-isolate?
C'est un peu peut-être difficile d'être trop spécifique. C'est parce que c'est selon les conseils de YCDC. Donc, c'est pas une demande générale. Donc, c'est très important que si on n'est pas certain, on suit les conseils de YCDC.
Thank you. I won't ask you to repeat those. You've spoken to both of them in English. So, maintenant, Laurie, Radio-Canada.
Oui, bonjour. Ma question est pour le Dr Brendan Hanley. Je vais vous demander de répéter en français, s'il vous plaît. Pourquoi est-ce que vous avez choisi une approche ciblée pour combattre cette éclosion qui est en fait la plus importante que l'on voit au territoire depuis le début de la pandémie? Pourquoi ne pas avoir choisi tout simplement de réimposer des restrictions alors même que vous dites que le variant Gamma se répand plus facilement et plus rapidement?
So, Dr. Hanley, can you repeat in French why you have decided to go with targeted measures to face the outbreak instead of going for a more general response?
Oui, avec plaisir. Donc, c'est important pour reconnaître qu'on a maintenant une éclosion qui est concentrée dans des groupes sociaux. Et donc, les groupes où, même si on n'a pas identifié tous les liens, on a des thèmes généraux que les associations avec les événements pendant la première semaine de juin. Associé avec les événements de graduation. Donc, on a déjà dirigé plusieurs centaines de gens pour suivre l'auto-isolation. Donc, même que c'est pas toute la société, c'est quand même une grande réponse. Et donc, c'est pour demander aux plusieurs centaines de gens de suivre l'auto-isolation pendant 2 semaines, c'est quand même significant. Mais on sait que le risque est très peu, le risque est très petit pour beaucoup de la reste de la population, en particulier ceux qui sont double vaccinés. Donc, c'est toujours la réponse qu'on a recommandée, c'est de suivre le risque, de déterminer où est le risque et de répondre au risque. Et c'est... il ne faut pas oublier que chaque restriction porte un coût. Donc, par exemple, si on a fermé des affaires, si on a fermé les lieux de travail, si on a fermé des camps, chaque prend une conséquence et conséquence sur l'habilité des parents pour continuer leur vie, pour la possibilité de continuer à travailler, pour la continuation de l'économie, pour la vie sociale, pour la vie mentale. Donc, le plus qu'on peut cibler la réponse, le plus efficace pour arrêter l'éclosion éventuellement, mais aussi pour le bien-être de toute la société.
Avez-vous une autre question, Laurie?
Oui, s'il vous plaît. Je me demandais, qu'est-ce qu'on fait à ce jour sur le traçage de la source de l'éclosion? Est-ce qu'on sait s'il y a un lien avec la réouverture de la frontière?
So, what are we at this point for finding the source of this outbreak, and what will happen if this outbreak is related to the opening of the border?
Peut-être juste pour d'abord, juste pour peut-être corriger, la frontière n'est pas tout à fait ouverte. Ce qu'on a fait, le changement était pour permettre les gens qui sont double vaccinés pour n'avoir plus besoin de suivre l'auto-isolation, la quarantaine de 2 semaines. Donc ça, c'était le changement le plus important qu'on a recommandé au gouvernement à partir du 25 mai. Donc, ce n'est pas une ouverture parce que la plupart des gens qui viennent du reste du Canada et les gens qui ne sont pas pleinement vaccinés sont toujours obligés de suivre toutes les règles de auto-isolation. Donc, on n'a pas trouvé une source exacte et c'est possible qu'on n'ava jamais trouvé la source parce que souvent s'il y a une source, un individuel qui par exemple peut-être c'était associé avec un voyage essentiel, un voyage médical, quelqu'un qui n'a pas suivi les règles d'isolation, c'est déjà répandu peut-être une génération ou 2 avant qu'on a détecté les cas, parce que ça dépend de les gens de subir au dépistage. Donc, c'est possible, on n'a pas trouvé la source. Ce qui est le plus important, c'est pour comment on peut empêcher la transmission quand on a une introduction. On a toujours vu pendant les derniers 15 mois des introductions des cas. Et la risque de répandement, c'est associé avec ce qu'on peut faire pour limiter la transmission des cas. Donc, voilà.
We have had a request for... Oh, Premier Silver?
Well, if you want to translate, and then I might say what you're saying.
The question was whether whether this was this outbreak has been linked to the opening of the borders. And I first began with saying the borders are, I mean, that whole question of what's an open border or not, for one thing, is a little bit technical. We do not have entry restrictions, for one thing, which I didn't say in French. But the second thing is that the quarantine, what we had was a very selective quarantine removal of quarantine restrictions around the fully vaccinated. So to me, that is not an opening. That is a selective exception to the need to self-isolate. So where the source is, we don't know yet, and we may never know. The reason we may not know is because you can often get, for instance, an individual who, for whatever reason, brought in infection. It could be that you had someone who did not comply with self-isolation. It could be associated with medical travel or essential work. We don't know, except that somehow infection got in. But what we may not do is be able to pick up that individual, but you pick up when you start to see spread. You may get a generation of spread, and then you start to see people symptomatic, and that's how you pick it up. So again, it's to bring us back to the theme of, it's not these, we've always had occasional introductions. We will get more. You cannot make a fortress that is impermeable. So it's what we do with these introductions that is the far more important factor in how we limit spread of COVID in the territory.
Premier Silver.
Yeah, that's the message. The borders have never been closed. You know, the numbers so far of travelers to Yukon over the last, since we've been dealing with COVID, is close to 100,000 individual units. So I think the last time the borders were closed was because of a flood, and the roads were closed years ago, and we saw overnight our groceries dwindled and our fresh produce gone. So, you know, you can't close down a border. We don't want to close down a border, and I think Dr. Hanley said it very appropriately. This was a small measure to allow vaccinated individuals to not have to self-isolate.
Thank you. I'd like to thank everyone for their time today. The regular COVID-19 update will take place on Wednesday, June 23rd at 10:30 a.m.